Hi, everyone, and welcome to today's LiveWire, How to Build Healthcare Communications that Deliver Exceptional Patient Experiences. My name is Abbi Minessale, and I'm a Product Marketing Manager here at SignalWire. And we are also joined by a special guest, David Higginson, who is the CIO at Phoenix Children's Hospital. Before we get started, I have a few housekeeping items to go over. So we will send a copy of the following slide deck to everyone after the presentation, and we'll also provide a recording to anyone who is registered in case someone you know is interested in watching after our live event. And feel free to ask any questions in the chat, and someone on our team will answer them. So before we get started, I have a brief overview of what we're going to be covering in today's LiveWire. We're going to be starting with market trends in the healthcare industry, and then we'll move on to discussing use cases and really dig into where communications touch patient experiences. Then we'll talk about how to build an omni-channel solution using SMS, voice, and video all together. And then I'll introduce David so he can talk about how Phoenix Children's Hospital found success using SMS. After that, I have a few live demos of an application that shows how we can improve patient experience that we built using our SignalWire tools. And then I'll open up the floor for a Q&A session. So let's get started. A lot of research has been done to analyze how mobile health can improve patient experience and improve efficiencies in healthcare settings. So when we're talking about mHealth, we're specifically talking about the use of mobile and wireless technologies like phones and tablets to support health objectives. So this includes mobile apps as well as messaging, voice calls, and video chats. Whereas telehealth is a broader term used to describe the use of any technology to provide patient care from a distance, which includes mHealth as well as other technologies like wearables, for example. The research shows that digital front door services like patient portals, pre-registration, text messaging, online scheduling, and virtual waiting rooms are important to patients. The overwhelming majority of clinical staff advocate for mobile use and strongly support its wider deployment. And when it comes to the market, 75% of hospitals report that clinical communications and collaboration investments are a high priority for hospitals. In fact, in 2021, the value of the global mobile health technologies market was at 55.4 billion USD, and it's estimated to grow to 224 billion by 2026. And while certainly an accelerator, we can see from this data that the growth and interest in communications technology in the healthcare setting is not limited to a temporary spike from the pandemic. Both patients and doctors see the need for better communication, and the market is backing that up. As of 2021, 49% of US hospitals had already developed enterprise-wide mobile communication strategies. And 42% of US hospitals were in the process of developing these mobile communication strategies. That means there's only 9% left of US hospitals who were not investing resources into communications technologies. We can see from this data that mobile health is no longer optional. Patients are starting to expect certain features like appointment reminders over text, automated call handling, and virtual appointments. So why do patients and care teams find communications technology like messaging, voice calling, fax, and video so important? Well, healthcare is incredibly sensitive. Unless it's for something like a routine checkup, people aren't going to the doctor because they're feeling well. And even then, it's a very vulnerable experience. By having multiple options for communicating, patients get to choose how they reach out, which increases engagement. When care providers can meet their patients where they are, it builds stronger relationships and a sense of trust. We'll also discuss a little bit later on how mobile health can be used to improve patient care and actually improve health results. As we talked about a few slides earlier, patients are expecting options in communication from their healthcare providers, and they're more likely to choose a provider if they have mobile health access. Of course, there's also the issue of saving money. Mobile health can save healthcare staff time and clinics money because we can use appointment reminders to avoid skipped appointments, and we can increase patient recall, for example, by sending reminders when it's time to book a follow-up or a routine checkup. And if we get a little bit creative with our voice deployment, we can put an end to staff sitting around on the phone, waiting to talk to patients and manually making appointments. We could set up an advanced IVR that allows patients to call in and make an appointment at any time of day, fully self-service. In fact, I've got a little bit of a surprise demo for everyone towards the end of this presentation, so make sure to stick around for that. And in the next few slides, we'll also discuss how mobile health can improve staff efficiency and the quality of communication internally. So when we talk about exceptional patient care, there are two prongs. We've got external communications, which is when staff is communicating with patients, families, or other members of a care team like family or pharmacies. And then we've got internal communications, which is how healthcare staff communicates with each other. So on this chart, we've got 4 icons representing the 4 different pillars in our communications technologies. We've got voice, which is any use case that involves phone calls, messaging, which includes text, as well as chat or MMS if we're sending pictures. Then, of course, you've got video chat and video conferencing, as well as fax. All of these pillars can be used to build standalone applications that you build from scratch, or implement increased functionality into existing patient portals or solutions that you've already built out. Evidence suggests that mobile technology actually has the potential to significantly improve communication and teamwork within a hospital and healthcare setting. Failures in communication contribute to more than half of all patient safety events. And texting or calling colleagues directly on their mobile devices rather than paging them has been shown to save critical time in emergency cases. Creating an internal network for staff to communicate with each other is a huge use case for voice and SMS. So for example, using SignalWire APIs, you can create temporary connections between phone numbers so that doctors and nurses can actually text and call each other without having to give out their personal phone numbers, which is a big win for privacy as well as work-life balance. In a hospital setting, staff are often in different physical locations, which is a huge blocker to workflow communication. For example, if a nurse needs to get in contact with a doctor from a different wing of a building, or even just a different floor, it's much more efficient to send them a text message with a quick question or make a phone call to get that information. In fact, 80% of hospital staff cite that SMS is their preferred method of communication. Text messaging can also be used to send notifications and reminders to care staff themselves. So for example, reminding employees to check their temperatures before coming into work during the pandemic. Workflow can also be improved using things like video chat as a way to communicate with staff in a matter of seconds, no matter where they are. Video APIs can be used to create your own virtual office so that every member of staff can have a quick access to face-to-face conversations. So think, for example, a primary care physician suggests that a patient should see a cardiologist. But first, they have to get a few routine tests done before their specialist appointment. So that physician can schedule a meeting with their in-house cardiologist just to describe the patient's symptoms and decide which tests to order for that patient. All immediately, all from the laptop, all without leaving your office. Of course, in the healthcare industry, fax is widely used internally for things like sending nursing orders and transferring medical records. And with our APIs, you can add programmable fax to applications, and that allows for traditional communications to blend seamlessly with cloud solutions. When we talk about external communications, there are a few different ways to apply this technology. So let's take a look at how each pillar of communication touches the patient journey. So we'll start with voice, and we of course have the application of doctors reaching out to patients over the phone. With a platform like SignalWire, doctors can use that same temporary connection that we mentioned earlier to call patients from a personal mobile device without having to give their real phone number to a patient. Patients can also make calls directly from a patient portal application just by clicking a button and making a call over voice over IP. So clicking to call right from the website, right from the application. Voice can also be used to send automated reminders to patients, reminding them of things like refilling prescriptions or booking follow-up appointments. And this is all over a recording, so you can send recorded messages to your patients. This is a very popular use case amongst elderly patients because they often prefer communicating over the phone. According to one study, 78% of consumers want to be able to schedule their own appointments at any time of day or night from their home or mobile device. And this goes across all age groups. And yet, only 40% of providers offer this. So, one way that we could fulfill this wish is through an advanced IVR, which is short for an interactive voice response system, the machine that answers calls for you and performs actions like transferring a call or hanging up or leaving a message, depending on which button you press. So with SignalWire, we can take something simple like an IVR and turn it into an experience that saves patients time rather than them getting stuck in complicated phone trees or sitting on hold for 30 minutes, which is my biggest pet peeve. So for example, we could connect a number to an artificial intelligence engine and create a virtual agent to answer calls and make appointments or quickly route outbound calls to the right department or inbound calls to the right department. So when someone calls and they need the cardiologist, the AI assistant can figure that out based on the conversation and forward the call to the cardiology department. In fact, it's a little bit of a spoiler for my demo coming up, so let's move on to messaging before I reveal too much. Messaging can, of course, be used for talking back and forth between patients and doctors, whether that's over chat or SMS or MMS, like we mentioned earlier. Messaging is a quick and accessible way for patients to get in contact with their care team to ask quick questions or clarifications. Messaging can also be used for things that we don't think about right away, but are just as important, like two-factor authentication to protect account privacy on your patient portal, or sending other kinds of account notifications. Of course, we've also discussed the use of appointment confirmations and reminders, which is a very good way to avoid missed appointments. And patients are 99% more likely to see notifications sent over text as opposed to something like email. I know personally, I always check my text messages and I'm kind of forgetful. So those reminders are very helpful and have saved me a couple missed appointment fees. Sending automatic reminders to book follow-up appointments every 6 months is also a great way to increase patient recall. So sending a text, hey, it's been 6 months since you've seen the doctor. It might be time to make an appointment, so that you can build that trust with patients and ensure that they're coming back over and over again. I've also seen very interesting and creative use cases where hospitals will send texts to patients opted in to a care team, like friends and family, for example, during a surgery so that they don't have to worry about how things are going. One study showed that 94.2% of family and friends felt more connected to their loved ones during surgery when they received these perioperative text messages. That is a huge win when it comes to improving patient experience. And in fact, that's something that David is going to talk about in a little bit. That is one of the use cases that they implemented over SMS over at Phoenix Children's Hospital, and he can tell you all about that. My last messaging example is helping patients who need chronic care, like for conditions like diabetes. Patients who are newly diagnosed, they might want reminders for when it's time to check their insulin levels or when it's time to replace equipment. And even those who have been dealing with chronic issues for a long time can still benefit from receiving these care reminders. In New Zealand, one healthcare company got very creative and offered a program for smokers who were trying to quit. So this program would send text messages periodically throughout the day to offer encouragement and advice. Hey, you got this. Hey, try taking a sip of water when you get that urge to smoke. Things like that. The program was so successful that the government actually bought the application and is now providing it for free to anybody trying to quit in New Zealand. While COVID-19 certainly propelled the use of video appointments, telehealth has proven that it is here to stay. 51% of consumers report that they want telehealth options from their providers. And video APIs are a great tool for building telehealth offices that go above and beyond to improve patient experiences. So, if, for example, we can create virtual rooms. We can have more than one room, just like in a real office, that we can send patients between. So, for example, nurses can look at the home screen and easily see who is in which room, and they can pop in and out to ask pre appointment questions like family medical history, just like you would in a real office. And then when a patient is done seeing their doctor, that patient can be sent to the virtual reception desk automatically so that they can discuss things like insurance issues or follow-up appointments. The best way to use communications technology to improve patient experience is to use all of the tools we just discussed in order to build an omni-channel solution. So, as an example, let's walk through a hypothetical patient experience. Meet our patient. We'll call him Fred. Unfortunately, Fred is not feeling well. He's been feeling very tired lately, and he's been getting these nasty headaches. And that's new for Fred. He doesn't usually get headaches. The first step, of course, is to make an appointment with his doctor. He can either book an appointment online on your existing patient portal, or he can call in where he'll interact with an IVR. Fred is a bit of a night owl, so it's 2 a.m. when he decides he wants to call the doctor. So instead of getting in contact with a live receptionist, because it's 2 a.m., he gets connected to an AI agent. He then is able to book his appointment with that artificial intelligence agent, and he gets an SMS confirmation for his appointment so that he's sure it's been scheduled. Like me, Fred is a little bit forgetful, but luckily he also gets a text message the next day reminding him to come in for his appointment at noon. Fred goes in person to his appointment, and he has to get a blood test to see what's wrong. So the next day, the test results come in, and his doctor sends him a text inviting him into the video room. It says, "Hey, Fred, your results are in. Let's go over them at video chat. We don't want you to have to drive in to the office 2 days in a row, so let's just talk over video. Is there a time that works best for you?" So Fred answers, and he goes into the video room during his virtual appointment, and the doctor goes over Fred's results and prescribes him vitamin D pills because Fred has a bad case of living in Wisconsin during the winter. I can relate. So the doctor then moves Fred into his receptionist's video room so he can go over an issue with his insurance and so he can book a follow-up appointment in 6 months to make sure everything is still going all right. After everything is sorted, Fred is able to pick up his prescription, and soon enough, he starts feeling better. Let's do one more example. So this is Paula. English is Paula's second language, and Paula has a surgery coming up for her hip. Dr. Fred wants to go over pre-surgery preparations with her, like when she needs to start fasting and what accommodations she'll need when she's discharged and healing at home. Paula's daughter, Mirabelle, is usually the one who helps translate for Paula, since English is Paula's second language, but unfortunately, her daughter is out of town. So during Paula's appointment, Dr. Fred starts a video room and invites Paula's daughter, Mirabelle, as she serves as part of Paula's care team. Mirabelle is now able to listen to all of Dr. Fred's instructions to make sure that Paula does not miss anything. A few days later, Paula is now in surgery, and Paula's daughter gets a text every few minutes from the care team updating her on how things are going. "Hey, Mirabelle, Paula's been seen by the anesthesia team. She's now cleared for surgery. We're halfway through Paula's surgery and everything is going as planned. And hey, Mirabelle, Paula is now out of surgery and resting." And now Mirabelle is able to click on the link and video call with her so she can visit and support Paula. Now I'm going to introduce David Higginson. He is the CIO at Phoenix Children's Hospital, and he's going to talk to us more about how he was able to implement SMS in order to improve patient experiences at Phoenix Children's Hospital.
Hello, everybody. I'm David Higginson. I'm the Chief Innovation Officer at Phoenix Children's Hospital. Just a little bit about the hospital. We're one of the 5th biggest children's hospitals in the US, serving the Phoenix metro area, which has been growing rapidly for the last 25 years. And we have over 800 doctors employed at the hospital, and we see nearly 400,000 patients a year. So it's a very big hospital. It's been growing rapidly over the last 15 years. So, and as you can imagine, at a children's hospital, we not only treat the very youngest children, we treat a lot of teenagers and their family members. And the predominant way everybody wants to be communicated with is text. There's not a single 15-year-old in the country that wants to call in on the phone and wait an hour on a call log just to get an appointment. So text is really, really critical for us. And it all started about 10 years ago when we were paying a big vendor almost $99 a provider a month for appointment reminders. Now, it may not seem like a lot of money, but when you've got 800 providers and 12 months in the year, that quickly adds up for just something simple like emails and text messages. So we decided we could probably do that better ourselves. And we went down the path of building our own text server at the hospital and kind of bringing that in-house. That worked great for a while as we grew. And we started to add some other functions as we realized that texting was really important to our families. And a great example of that is I would call what we call normal lab results. And if you think about taking a patient to the hospital, let's say you've got a daughter and you're concerned that she may have lead poisoning and she may be suffering from that. So you go to the hospital, the doctor does a lead test, and they say, we'll get back to you with the results. Well, if you're like me as a dad, every day after that, I'm worried. I'm just assuming the worst and thinking my daughter has lead poisoning. And so it's really critical to me to know what that result is. But the way hospitals work is they don't call you back unless the result is positive, i.e. there's something bad. If the result is negative and there's no problem, they don't have the time to call you back. They don't call you back. And so what ends up happening is the family calls in on the phone tree. They're very stressed, trying to find out what's going on. It disrupts the nurse's time, and it can be bad for everybody. So we figured out a way to deliver our normal lab results back to families. Now, if there's a positive or a bad result, we let the doctor call up. But for normal labs, we text them immediately to say everything's okay. And so families have a great sense of comfort about that, but also we avoid lots of phone calls into the hospital. And so we added that normal lab function. I was so popular that we there's got to be something more we can do with texting than just appointment reminders. And so that began our journey about really trying to use texting as the frontline communication to families about everything that was going on with their care and really bring them into that electronic ecosystem of the hospital and include them in all that electronic communication. So we've expanded greatly over the years. One of the things we ran up against in about 2017, 2018 was that we just couldn't text the number of text messages we wanted to send every day. We just got behind. And so we'd be texting people at 9 o'clock at night, and it was getting late for families, and we didn't think it was appropriate to text families and kids at 9 o'clock at night. Maybe they were going to bed and all those kind of things. So we had to find a way to scale up our delivery. Back then, we were doing about 1 million text messages a year. And the other thing we found out when we were texting over normal numbers, we were getting denied by the carrier a lot. So a lot of texts wouldn't go through. Nothing we could do about it. We didn't really know how to approach that. And it was about that time I started looking for a kind of a bigger scale partner in this. And we found SignalWire at that time. And with some guidance from then, decided to go with what's called a short code, which you've all probably seen that when you get a message from a 5-digit code. Most importantly, that allows those messages to be delivered very reliably. You almost go kind of through a pre-screening exercise with the FCC. They decide what you're doing, they make sure it's okay, and then you kind of get the golden ticket, if you like, to be able to deliver messages to nearly everybody's phone, which was really important for us because our messages were starting to be really important to patients' health, not just reminders. So we went through that short code process, which is a little daunting, I've got to tell you, for someone who doesn't work in this industry, but we got help throughout the way, and SignalWire really helped us through that process. It took about 3 months. And just luckily for me, I happened to do that right before the pandemic hit. So we got into about November 2019. We got the short code, had our use cases. Life was great. We'd switched over. And then the pandemic hit and telehealth went through the roof and everybody wanted to communicate everything via text. So thank goodness we had that in place. But we rapidly broadened in 2020 to a lot more use cases of texting. We're now at nearly 4 million texts a year coming out of our organization. And I'll just run through with you some of the examples we use, but this is by no means a full list. Obviously, we do telehealth, so texting is a critical way to get the link to the telehealth session to people. We found that most of our patients don't read emails, especially in a timely way. And for them to get the link for the telehealth session, texting is the only way to make that happen. Another thing we found during COVID is we needed to remind employees, especially early on in COVID, is to take their temperatures, log their temperature, and don't come to work if you're not feeling well. And what we did is we detected the badge scan when people scan the badge to get in the parking lot to park their car on the way to work. And we used that badge scan to trigger a message to remind them to log their temperature and not come to work. And that was incredibly successful because you can imagine a great number of employees weren't coming to work and they didn't want to get bombarded with a text message every day. They just wanted to get that text message when they arrived at the hospital. So that was a really great use case for us. And then we've broadened into a lot of areas that were mentioned before. So we allow full self-scheduling, so employees can schedule or patients can schedule themselves for appointments. So all that self-scheduling is done via text and the web. And the text is really the call to action for that. We have implemented wait lists. So a lot of our appointments are backed up. There's maybe a 3-month waiting list for an appointment. Families can sign up for that wait list. And as soon as an appointment becomes available, if someone cancels, they immediately get a text message and they can grab that appointment. And for a family that's very concerned about their child with a potential diagnosis, it's really, really critical for them to be seen sooner. And so those wait lists are incredibly popular, and texting is really the only way that works. Another thing we do is we text families with what we call to-dos or things we want them to do. So maybe we need them to fill out a form before the survey, before the visit. Maybe we have a survey for them to complete. Or maybe, they've gone home already and we just need to get updates on their care. Every week we need to find out, hey, how are your headaches? How is this thing that we treated you for? Is it getting better or worse? And so we use texting as the call to action for all of those activities that we need the patient to do, both before, during, and after their visit to the hospital. And again, it's the kind of lifeline between us and the patient. An important thing to mention here is that all the responses and all the messages sent to the patient are actually visible in our electronic medical record. So every doctor, every nurse, every caregiver is able to see in real time the exact conversations going on with the families and be able to roll back through that history and see what's happened before. And that's incredibly useful to go back maybe a month or a week and see what was being communicated to the family. And you can imagine with phone calls, that doesn't happen. Someone leaves a voice message, someone has a phone call with one person, there's no documentation of that. And so oftentimes families are frustrated that they have to kind of repeat themselves over and over again. So that employee to patient chat function is really, really critical. I do want to mention that HIPAA is a really important component. And so we spend a lot of time filtering out any clinical information that could possibly go on over the text message and kind of catching that if someone accidentally types it in. And it's something you really need to pay attention for because texting is really not HIPAA secure. And so you have to be very careful encouraging physicians and employees to use texting as a platform to share patient information. That's not really appropriate. But if a family is sharing that with us, that's their choice. And so that's okay. It was mentioned before that we also keep families up to date as their visit is happening. So if you're in surgery at Phoenix Children's, every single step of the way, you're getting an update, not only on a plasma screen where you can kind of see what's happening if you're sitting in the cafeteria, but on your phone, you are getting text updates of everything that's happening, that anesthesia started, that the surgery started, that surgery is ending, patients going into recovery, all those key updates of the surgery being texted to families if they want them. Incredibly helpful, especially if you're one of the parents that's not able to be at the hospital that day. You can be at work and get a good sense of what's going on. So sending those visit events and surgery events to people is really critical. Another area where it's really important for us is the emergency department. Some of our patients can spend up to 3 or 4 hours waiting to be seen in the emergency department, and letting them know via text message that we still know they're there. We know they're waiting. If anything bad has happened since then, to come and see us, but really keeping that communication channel open to them via text messaging is really critical. And that's one of the things that we found. And so, I've given you a lot of examples there, but what I'd really tell you is that texting is a lifeline to our patients. It allows us to keep in communication with them, let them know what's going on when doctors and nurses don't have time to do that. And if you really think about those precious resources of doctors and nurses, kind of the last thing you want them to be spent doing is answering the phone or giving routine updates to patients when we can just automate that through text message. Better for the family. They get it when they want it. They're not getting called. And it's much better for the staff because they're not getting distracted away from the critical work of taking care of patients. So like I said before, texting has really been a critical piece of our patient family experience. And I don't know what we do without it. And luckily, we have great reliability. I don't think we've had any downtime in the last 2.5 years on SignalWire. And with the number of messages that we send out, it's really, really critical to our care that we give at the hospital.
Right. I just wanted to briefly touch on the campaign registry. So whenever you're sending messages, regardless of your provider or your use case, you're going to have to go through the campaign registry. Unless you're using a short code like David, if you're using 10DLC, a 10-digit long code, you have to go through the campaign registry. And what that is it's a database that establishes a common standard for application to person messaging. And it's just a database that keeps track of all of the messaging use cases being sent application to person with the goal of preventing spam and keeping spam off of people's phones. So this is a third-party company that is required by the carriers themselves. This is not something that we personally require. It's from the big name carriers like Verizon, AT&T, etc. And when you hear the word campaign, your first thought is probably marketing, but it's not a marketing term. In this use case, the campaign registry calls a use case a campaign. So any use case you're using is a campaign that you need to register. So for example, when it comes to healthcare, that would be 2FA, account notifications, customer care, delivery notifications, things like that. Luckily, here at SignalWire, we have carrier ops experts who can help you get your campaign approved the first time. We can strategize with you to get the highest deliverability and throughput possible. And we have a few experts in the audience as well if you have any questions today. To get started on that is so easy. All you have to do is go to your SignalWire space, and we have a TCR wizard built into your space where you fill in all of the information so you can start getting your use case registered and your messages sent right away. I wanted to talk about the SignalWire difference and take a look at how SignalWire can help you get started building out these solutions. So SignalWire is easy to use. We offer easy to use APIs that range from low code, no code to highly flexible that make it quick and easy to deploy communication solutions to patients. We also offer compatible APIs, so it's fast and easy to move over from a different provider. So you can get up and running in 5 minutes. We're also very secure. SignalWire's APIs are designed to help with HIPAA compliance and protected health information requirements. And we will also execute a business associate agreement, a BAA, to qualifying customers. Again, reach out to sales for more information on that. Like David said, SignalWire is very proud to be reliable. We offer a 99.99% platform uptime to ensure that you are always available to your patients. And when you work with our teams, we can help you strategize and navigate that carrier world in order to get you the highest deliverability and throughput possible when we're sending text messages. Our support is full of experts. We've got 24/7 access to our US-based support team, so you never have to delay your development processes to wait for answers, and you can get any issues you have fixed ASAP. Everyone on our support team is either a developer or a technology expert themselves, so we're always ready to help and pick up the phone. We also offer a complete solution. So we've got fully integrated suites of communication APIs, including voice, messaging, video, and fax to deliver a truly omni-channel communications experience for patients. It's pay as you go, so you save up to 50% when you switch to SignalWire, and you only pay for what you use as you use it. And you can also gain access to volume discounts as your traffic scales. Speaking of scalability, our developer-friendly Elastic platform is built to automatically scale as you increase your traffic, so you can grow as you go. You can easily scale up or down without having to worry about any of the back-end complexities. So this is a lot of text. I'm not going to go over all of this, but this is a brief overview of our HIPAA and security information. You can pause the video to read it, or if you're registered, we'll send you a copy of this slide deck. Just to summarize, SignalWire is fully HIPAA compliant, and we are able to sign those BAAs to qualified customers. Reach out to sales@signalwire.com to learn more about that. No personally identifiable information, private resource logs, or other records are publicly accessible, and you have to have specific access granted by your space administrator in order to see logs in the dashboard, and you have to have API credentials. We also recommend that each application programmatically accesses SignalWire. We recommend that any application that uses SignalWire has its own API tokens, so you can easily see when a token has been used and remove it if necessary. Again, if you have any specific questions about HIPAA or security, please reach out to us and we'll put time on our calendars and go over that with you. So now for the fun part, I've got a demo to show everyone today. We're going to take a look at a working prototype of a virtual AI assistant. So we're going to make a call to Dr. Geek's office, and we're going to see if we can make an appointment. And that artificial intelligence is going to decide whether or not we should come in person or come in over video. So I'm calling the number. This is 640-CALL-DOC.
Hello, thank you for calling the doctor's office. My name is Amy and I'm here to help schedule your appointment today. Before we proceed with scheduling an in-person visit or a virtual video visit, may I ask if you have experienced any COVID-19 symptoms such as fever, coughing, or shortness of breath within the last 14 days?
I don't think I have a fever and I haven't been short of breath, but I do have a bit of a cough, which I'm concerned about.
Thank you for letting me know. Based on what you've told me, it's possible that there may be a risk of COVID-19 infection. For your safety and the safety of others in our office, I would recommend scheduling a virtual video visit with one of our doctors instead. Would you like to schedule this appointment now?
Yeah, that would be great.
Great. To schedule a virtual video visit, I will need to know your phone number and email address. Also, please let me know what date and time works best for you.
Yeah, my phone number is 262-303-6321.
Thank you for providing your phone number. May I also have your email address?
Oh, yeah. It's Abbi@signalwire.com.
Thank you, Abby. I have your phone number and email address on file now. Our office hours are from 9 a.m. to 5 p.m. Monday through Friday. What date and time would work best for you?
What is the soonest appointment I could get in on a Tuesday?
Our next available appointment for a virtual video visit is this coming Tuesday at 10 a.m. Would that work for you?
So 7 days from now?
I apologize for the confusion. I misunderstood your question earlier. Our next available appointment is actually tomorrow at 2 p.m. Would that work for you?
Oh, yeah, tomorrow at 2 p.m. is fine. Wednesday is fine.
Great. I have scheduled your virtual video visit for tomorrow at 2 p.m. You will receive an email confirmation shortly with all the details of your appointment, including a link to join the call. Please make sure you are in a quiet and private location during this time so that our doctor can provide you with their full attention. Is there anything else I may assist you with?
Could you send me a text to remind me about that?
Sure, I can send you a text reminder. May I have your phone number again to confirm?
Yeah, it's 262-303-6321.
Thank you, Abby. I have scheduled a text reminder for your virtual video visit tomorrow at 2 p.m. Is there anything else that I can help you with?
No, thank you. That's all.
You're welcome. Abby, it was a pleasure assisting you today. Please don't hesitate to call us back if you have any further questions or concerns in the future. Have a great day. Goodbye.
And then it automatically hangs up. So we did this by connecting SignalWire to an artificial intelligence engine so that you can trigger calls and messaging actions based on the conversation that you have with the AI. And this is actually going to be available soon as a low-code product here at SignalWire. So keep an eye out for more announcements about that. But there are so many different applications for something like this. AI is such a powerful tool, and it can be used to increase efficiency so that time can be spent on patient care instead of spending time on the phone. So now that we've got our demo out of the way, I'm going to open up the floor for questions that you may have for me or David. I know I saw a couple sent to me over chat. We'll pull up David. I know one question that I was asked is why did you decide to go with a short code instead of toll free or a 10 DLC number?
Yeah, we went for a short code for a couple of reasons. The really main reason was we felt that would get better connectivity to our patients. We have a lot of different carriers that our patients use, and we found that the short code has much better kind of penetration to make sure we can get most of those messages delivered. The second thing we didn't really think about at the time, but it turned out to be an important factor, was that parents and family members kind of attach more trust to a short code. So when they get a message from a short code, it makes them feel more comfortable that they're actually talking to the hospital and a real organization. So it adds more credibility to the texting in our experience. And the other thing, which is really just more of a factor of the way we do all the texting ourselves, the families and the parents like to get all the messages from the same number. I've got some colleagues at the hospitals who bought solutions from 5 or 6 different companies, one company for appointment reminders, one company for surgery reminders, and a different one for self-scheduling. And the families end up getting the messages from lots of different numbers, and they get confused which one's a hospital and which one's not. So by kind of integrating it and coordinating it all through one shortcode number, we found a lot higher trust in that message. And, we have 60 to 70% call to action click-throughs on those messages, which is really good a response rate from our perspective.
Quick question on that. Are all of your use cases on a single shortcode, or do you utilize multiple shortcodes?
No, it says all on a single shortcode, very much by design. Again, so the families get the one number. We do have a sister organization that is an accountable care organization that takes care of a different set of population. They have their own shortcode because they're really a different entity, and it needs to be able to draw the distinction. But we really like the fact it's all on one shortcode because that gives us that consistent message coming from the hospital. I've seen lots of families who've changed that name to put Phoenix Children's Hospital against it so they know what it's from.
And how was that process getting those use cases on that shortcode? I asked from experience with others where it was not as easy.
Yes, it's quite tedious. And, having to try to think of all the different ways we need to do it, provide all of the documentation for people to follow through, all of the disclaimers and the opt-out, opt-in capability. On the front end, it can seem a bit daunting, and it's often a little easy to just say, I'll keep it easy and go with the 10-digit code. But I'm so glad we did, because during COVID, we never could have gotten the throughput and the reach that we got with a short code. So it's a lot of pain on the front end, but I think it's all definitely working on the back end from our perspective.
Excellent. Appreciate that.
Great question. Let's look. Privacy. So how do you navigate the privacy issues when it comes to text messaging?
Yeah, so I appreciate your comment earlier about how the SignalWire platform is HIPAA compliant, but obviously the messages, the words sent over the text messages, HIPAA does apply to those as well. And while that's not the responsibility of SignalWire, it's certainly my responsibility from a hospital organization. So it's increasingly, it's very difficult to go through that education process to make sure that only appropriate information is shared. Now, that's been a problem in healthcare for years and years, with individual doctors texting each other on their phones, details that probably shouldn't go out. That is just an educational process. But from our perspective, because we really control, for the most part, what goes out, we actually have a compliance officer read through every template text message that we send out to make sure it's compliant. We know exactly what we can say and what we can't say. But we have an extra duty of responsibility with our patients is we don't want to text the parent something that's sensitive to the child. So if you've got a 15-year-old female who's maybe gone to the hospital for something that they don't want their parent to know about, and it's completely within their rights, we don't want to accidentally text that parent for something that's not appropriate. So we have to walk that very fine line between knowing what's appropriate. But privacy is a real challenge. And then obviously one of the things we allow recently is our employees are able to text our patients directly on that short code to send them messages they need to send them so they can have a quick conversation with them. And so again, educating 5,000 people who work for us all on the same levels of HIPAA and what's appropriate is a challenge, but we do pull it off. We have a lot of screening that goes on where we replace words if someone or warn people ahead of time. But yeah, it's a constant concern of mine. And there's no easy answer, I would say.
Great, thank you. Let's see. How have you seen communications change from before and after the pandemic? You mentioned that text messaging, you're glad that you hopped on board right before the pandemic. Now that, of course, there's still a little bit going, but now that things are calming down, how have you seen that relationship with telehealth change?
Yeah, so I think we were seeing the pickup in text messaging long before the pandemic, and certainly in our younger and our patients who are often in their teenage years, they really resonated with texting. They don't want to, and I've talked to many families, they don't want to wait on the phone for half an hour on hold just to book an appointment because they got to be sitting on hold that time. So they really like the kind of asynchronous methodology of texting. But when the pandemic hit, obviously, we went from having maybe less than 3% of our appointments in telehealth to having 70% of them via telehealth in a matter of 2 weeks.
Wow.
So a massive change. And so to coordinate all that work and make sure the patient and the physician is not frustrated and they're making the best use of their time, texting was really kind of the flight traffic controller that was keeping everyone coordinated. And so texting played a huge role in the way that everyone communicated with each other in the moment. Now, telehealth has eased off again now. We've kind of settled back into a rhythm. We found that some diseases, telehealth is actually the better way to go. So if you've got a patient with mental health or behavioral health issues, it can actually be a triggering event sometimes to have to come into the hospital in an alien environment with a doctor with a white coat. You often want to have that patient sitting at home in their bed and they're much more comfortable than they are trekking all the way to the hospital. So many areas, telehealth is still very strong and it's actually becoming a standard. So it's very much still used in that. But in other areas, texting, while we're not doing as many telehealth visits overall, there are many more things now that everybody just wants to interact with over text. And what we found was in terms of telehealth is while we're not doing that exclusive patients at home, doctors at the hospital, what we're having is one member of the family come in with a patient, they're all in person, but then we're having kind of a hybrid visit. So we're having a couple people on telehealth or on Zoom and 3 people in the meeting. And so again, we still need to coordinate all that activity. So texting is really important, but we continually find every month new ways to use texting to cut out kind of human elements of the visit and get the patients out of the hospital quicker, because everybody doesn't want to hang out at a hospital, especially if you've got 3 kids running around and they all need to get back to school. You want to get out there as quickly as possible.
We will close out with this question. What would you say is the number one important thing to consider when communicating with patients? Any best practices or advice you can give?
I think you have to be very careful not to over communicate. So when we first started with texting, everybody told me that patients didn't have a phone, they never get the message, no one wanted texting, they all wanted a phone call. So early on, I had a lot of resistance that no one wanted texting. Then once texting was popular and patients liked it, then we kind of flipped 180 and everybody wanted to send everything out over text. So I actually personally control every new text message that goes out, not only because of the short code requirements, but we really turn more use cases down than we do accept them, because without caution, we would flood families with all the things that our employees think are important for them to know. And you can imagine if you're on the receiving end of that and you get 50 text messages basically spamming you all day long, then what I tell people is that only takes one stop from a family and all that communication is cut off. So as the question was early on, with one short code, we stand the risk if we spam a family and they respond with a stop, all my messaging stops and they may not realize that they're losing their appointment reminders, their wait list, all that functionality. So I would say at this point, I'm much more cautious about saying no than I am about saying yes. There's just many things that aren't appropriate, and we have to always keep our families in mind.
Interesting. Does anybody else have any questions before I close out?
I had one last question for you, because we've talked a lot about SMS. I'm curious if you see or have use cases where SMS is not the correct channel, and maybe voice is and still will be the main channel. And do you all utilize that in a programmable fashion?
So voice is a commonly used, it's kind of lowest common denominator, a little bit like fax was talked about before. I don't think it's anybody's preference, but it's kind of the one you always have to have. So we're not actively pushing it at all. There are a few other use cases. So obviously people are wanting to really ask their questions online a lot of times. So online, like the AI example that you talked about, people want to type the symptoms online, get a recommendation of where they should go. And so that's often done. But we are also kind of, for employee communication, it's an interesting question about whether it should be SMS or whether it should be more of an internal channel like a Slack or a Microsoft Teams or both. And so we have a lot of times where we have a shift open up for a new nurse and we need to try and get that filled. So the question is, do you send it over an internal channel like Teams, or do you send it over a text message? And it turns out neither one is the perfect by themselves. You got some people who would miss it if they're at home, if it wasn't via text, and then some people who want it internally because they're right there at work. So what we found is it's more additional tools. It's not taking one away or replacing. It's just unfortunately layering on more and more. But the fax and the phone is never going away. You wouldn't believe how many faxes we still get from outside doctors, and that's just the way they want to do it, and they don't want to change. And so it always seems like we're just adding more and more on top of the stack, not necessarily taking anything away.
Gotcha. I appreciate that.
Any more questions? Perfect. Thank you so much, David, for joining us. That was so informative. Thank you, everyone, for joining us today. Keep an eye out. We'll have many more live wires to come. As I mentioned before, this entire presentation has been recorded, and all the slide decks and information are available to anyone who registered. Thank you, everyone, for joining us, and have a great day.
Thank you.